Tasha Carradine here, and we're going to have some news right now about something that affects 1 in 3 adults who have had chickenpox. And yes, you know what I'm talking about. It is shingles, the shingles virus. The talk of it has erupted again because a doctor in PEI wants to see the access to the vaccine be made free for adults 55 plus. That would be lowering it because right now 60-year-olds in PEI are eligible for the free vaccine, but not if you are younger. Here in Ontario, adults can get the vaccine free of charge if they're 65 or older. So what exactly is shingles? What are its symptoms? Why is vaccination becoming such a live issue? And how do you feel about it? How do you feel about the idea of lowering eligibility for the vaccine? Should it be free for Canadians 55 and over, 50 and over? And have you had a shingles story of your own that you want to share? Give us a call, 416-360-0740 or 1-866-740-4740. Should we lower the eligibility age for the shingles vaccine? And if you had an experience with it that you think our listeners and our guests now would benefit from. I'm joined by Dr. Alon Vaisman. He's an epidemiologist and infectious disease specialist at the University Health Network, and Molly Yang, pharmacist and director of pharmacy innovation and professional affairs at Whole Health Pharmacy Partners. Thanks for joining us today.
Thanks.
Thank you. Happy to be here.
Oh, great. Well, so let's start with a primer on shingles. Dr. Vaisman, what is it? The symptoms, the effects? Give us sort of an overview of this disease.
So the shingles is caused by a virus called varicella zoster. And typically, before we had vaccinations, what would happen is that we would all be exposed to varicella zoster at a young age. We'd get chickenpox, and then there's no cure for the virus, and the virus lives inside you essentially for the rest of your life. So it goes latent, and it lives in your spinal cord for the rest of your life if you've never been vaccinated. So people with this infection, as they age, there's an increased risk of this virus reactivating, which means that it starts to appear on a specific part of your body for a few days. And these look like the shingle. It looks like the chickenpox lesion somewhat. It looks like what we call a little vesicle, so a little fluid-filled sac. And the problem with shingles, even though it only appears on one strip of your body, unlike the first chickenpox, which is your whole body, it still causes significant pain. And in most people, this manifestation is self-limiting and it goes away. But in some people, it has residual pain after you get the shingles. In very sick individuals who are immunocompromised, they may get a more disseminated, very severe infection. So the way that you can prevent this shingles from coming back is to remind your immune system by getting the shingles vaccine, which is now Shingrix, which is widely available here in Ontario.
Okay, I'm itching just listening to this. I know that I've heard shingles is horribly painful and something that no one wants to get. But Molly, we are, you can only get the vaccine for free if you are 65 and over in Ontario. From your perspective, should that change? I mean, what is the cost first for getting this vaccine?
Yeah, that's a great question. And to clarify, in Ontario, the provincial program will cover it for patients who are 65 to 70. So within that age frame, if you're 50 to 64 or 71 and plus, you won't be able to get the vaccine for free. There is a great amount of evidence showing there is benefit to patients getting it from age 50 and up, just because as we age, our immune system declines. We're more prone to getting these reactivations, as Dr. Vaisman explained previously. So obviously anything that can improve access would be great for all Ontarians and obviously for all Canadians. In terms of the cost, it is a costly vaccine. Each dose is about $150, and you need 2 doses to be able to be fully protected.
So a $300 vaccine. Now, is this currently available on the, privately? Can you go and just pay for this vaccine if you want it?
Yes, so there is a lot of great coverage. If you have private insurance, it may be covered by your plan, and you can double check with your plan in terms of what it includes. Even if you don't have a prescription, this is actually a non-prescription vaccine, so you can go to any pharmacy in Canada if you're not covered and say that you want to get the vaccine, and they could provide it to you without the need for that prescription if you want to pay for it.
Okay, so it sounds, if you have coverage, if you have the money, you can access this. Dr. Weissman, we pride ourselves in this country on, of course, public health care, and everyone should be able to access the same level of care. How significant is this gap in terms of making people sick? I mean, how many people are at risk and can't get it because they can't afford it in that age group from 50 to 65?
Yeah, certainly as we age, we have a lifetime risk of one in three chance of the shingles occurring. So anyone who's had chickenpox as a child or earlier in their life has a 33% chance that this will recur. And some small proportion of those individuals will get a significant amount of pain associated with their shingles that last greater than 90 days. And it's estimated that for people 65 and older, around 10% of them will require a hospitalization at some point in their lives due to reactivation of shingles. So there is a significant amount of morbidity associated with shingles. And again, that unfortunate subgroup of people, they do have permanent pain associated with it. So the better job we do at allowing people to access the vaccine, and by the way, the other thing is that it's very effective, the vaccine, at reducing this pain associated with shingles, which is called post-herpetic neuralgia. And so the better job we do at getting this vaccine to people, which is very effective, the more we could do to help prevent these hospitalizations and the permanent pain associated with it.
Well, yeah, we should definitely, nobody wants to be left having pain from this virus. It's very painful when you have it, but to have it lingering and 90 days, I mean, that is a very long time. I'd like to hear from you, listeners, as you listen to this. If you've had an experience with shingles that you think, well, that could have been prevented if I could have had the vaccine. If there's an experience you think you want other people not to go through, give us a call, 416-360-0740 or 1-866-740-4740. We're discussing whether free access to the shingles vaccine should be increased. Right now, it's people 65 and over in Ontario. Other places, PEI, they're talking about dropping it to 55. It's 60 there right now. In Alberta, they're saying it should be free to everyone who's 50 and over. So is our government doing enough here? Should we drop the age of eligibility for the shingles vaccine, make it free? It's about $300. That's quite a bit, but it sounds, just listening to this conversation, Molly Yang, that, there's a lot of people who will be out of work, out of, suffering in their lives, a lot of cost to the economy probably from not giving people this vaccine. Would you agree?
Yes, certainly. As Dr. Weissman said before, it's not just the acute rash that you get. It's a lot of those potentially long-term complications that you can get from from shingles as well.
All right. And I think Ron in Port Perry is called in. And you said, Ron, you wouldn't wish shingles on anyone. What was your experience with it?
Well, I wished I could tell you that it was over, but it's not.
I'm sorry.
Right now, no, it's okay. I'm dealing with nerve damage on my right chest, my right shoulder blade, and under my right arm. And this is 2.5 years later. And I do take one pill each day. To be honest with you, whether it helps or not, I don't know anymore. But I could highly recommend to absolutely anybody. I wouldn't wish this if I had a worst enemy. I wouldn't wish this on anybody at all. So, if you haven't had a shingles vaccine and it won't, you don't want to get this. It's bad news.
Okay, well, I'm really sorry that you're still suffering from it, and I do hope you get better. It does absolutely make the case for why vaccination is so important. Going to go to Angie in Etobicoke. Angie, you have a shingles story, but of a much younger patient. Tell us that.
Yes, I was very surprised when my son was 14. He was diagnosed with shingles, and he did have the chickenpox vaccine, but he's never had chickenpox. He had the vaccine when he was a child. So now I'm really worried about his senior years. Does this mean he's likely to have it recur more than the general population?
Well, that's a very good question. I will put it to our doctor, Alon Weissman, epidemiologist. Alon, do you think, how will this affect this young man as he grows up?
Yes, so certainly the risk of reactivation is higher as we age, but it can happen spontaneously at even younger ages, even in teenagers or people in their 20s or 30s. Having had a reactivation doesn't necessarily put you at risk for more reactivations later in your life. Unless there is something identifiable that you can reverse. So some people have, for some reason, a weakened immune system. And if you can reverse that weakened immune system, you could prevent a reactivation. But very often, there is nothing specific that we can identify that caused the reactivation, especially in young people. But it doesn't necessarily mean that this person will have more reactivations later in life. But it does, again, highlight the importance of getting Shingrix once these individuals do go over the age of 50, because the research shows that it is very effective at preventing reactivations at that age.
All right. I'm going to take a call here from Jim in Pickering. Jim, you have a question for our guests about shingles. What is it?
Well, yeah, good afternoon. Yeah, I'm 77 myself, and for the others like me who are over the 70. So they provided you need to be 60, right? And they will provide the free vaccination, but they cut that off at 70. Why is that?
Okay, that's a good question. Molly Yang, why is there a cutoff at the age of 70?
Yeah, that's a great question. And, it's a question that we get at pharmacies a lot when patients come in. And, from a systems perspective, each province will make their own decisions as to what makes sense in terms of funding for a particular age range. In other provinces and for other programs like for NIHB, in PEI and, for Veterans Affairs, we see that initial age range and onwards. But in Ontario right now, it is 65 to 70. And I just want to note previously as well that within that age range, 65 to 70, to be able to get the vaccine at no cost, you'll have to get it from either your primary care provider, so your doctor, or from public health. Pharmacies don't have access to that publicly funded vaccine.
Okay, thanks for that. We have another question here from Angela in Etobicoke. Hi, Angela, you're on the air. What's your question?
Yes, I had the Shingrix vaccine 10 years ago when there was only one vaccine, like one shot. So now I'm wondering, 10 years later, I'm hearing that there's two shots that are necessary for this vaccine. Do I need to go and get a second shot?
That is a question maybe a lot of people have on their mind. So I'm going to ask Dr. Vaisman, if you've had one shot in the past, should you be getting some kind of booster?
I think maybe what this individual might have gotten was the older vaccine that's used in this population called Zostavax, which has since been discontinued. And the new vaccine called Shingrix, I believe, was approved somewhere around 2017. So it might have been that maybe 10 years wasn't accurate. Maybe she had their vaccine, one shot in 2017. If that's the case, if she only had the Shingrix in 2017, she could certainly receive the second dose. It is quite a long time, but it is a two-dose regimen, and usually the first two doses are spaced between 2 to 6 months apart. If it was just the Zostavax that she received 10 years ago, then as far as we know, there isn't benefit to repeated boosting. So even with Shingrix, once you received the two-dose regimen, as far as we know, you don't need to be boosted later on in life. So she may be done if she, in fact, just received the one Zostavax.
Okay. I have a question about the effects of the vaccine, because I've heard that it is also not a walk in the park. Molly Yang, is that true? Or should people be concerned about, obviously it's beneficial, but what's the experience like when you have the vaccine?
Yeah, so that is a common topic that comes up around Shingrix vaccine, because the vaccine has an adjuvant to help boost the immune response to the vaccine in older individuals. It can cause some side effects, which are quite common. So that could be local pain where you got the injection. It could be fever for a couple of days, headache, fatigue for a couple of days after. But often these symptoms, while you're experiencing it, might be tough to handle, usually within 2 to 3 days after the vaccine. They're usually mild to moderate, and they will improve. It's usually recommended, if you can, to take a couple of days off to rest in anticipation. But, in thinking about the long-term protection that you get from this vaccine, it's definitely worth it for the usual mild symptoms for a couple of days after the injection.
All right. And I think our next caller can probably give us some perspective on what it's like to have shingles versus what you just described. Carmel and Brantford, you have shingles right now?
Hi, yes, I do.
And what's that like?
I was diagnosed last Wednesday, misdiagnosed on the Monday at the hospital, but had to go back on Wednesday because I was in a lot of pain. And eventually, after 10 and a half hours, an actual doctor came and looked at me and said, "Oh, my goodness, you've got shingles."
And how's the pain for you?
The pain now has subsided a little, bearable, I would say, but in the beginning, really bad. Absolutely, I wouldn't wish it on anybody.
All right. Well, that's the common thing, right? And people don't wish it on anyone, but when they express that, it's because they've had it and they haven't had obviously a vaccine to prevent it. So I think the message in all this today that I've heard from Dr. Vaisman and Molly Yang is get that vaccine. And it sounds like we probably should be lowering the age of eligibility to avoid this kind of pain that we've been described. I want to thank our guests very much for coming on today, Dr. Alon Vaisman and Molly Yang.